We are a dedicated group of social workers with specialized skills, knowledge, and interest in mental health issues. All of the social workers in the mental health program hold at least a master's degree in social work, and we are all registered with the BC College of Social Workers. We are all very passionate about the patients and families we work with and the unique challenges that they deal with. Social workers are available to patients and families on our inpatient hospital units, outpatient mental health and wellness clinic, complex pain center, neuropsychiatry unit, inner city youth team, and our eating disorders program. In all of these areas, the social worker is a key member of the interprofessional team. When patients are admitted to the hospital or seen on an outpatient basis, we work closely and collaboratively with them and their families and friends, as well as other professionals both inside and outside the hospital to support patients' wellness and recovery. We believe that this ultimately contributes to a smooth discharge to their home and helps each individual to have a safe and secure support plan. Most important, there is a plan in place that they as the patient have been involved in creating. When a patient or loved one is admitted to hospital, they can experience a range of emotions, such as feeling scared and overwhelmed. They may also feel a sense of relief to be looked after, but also have concerns about their future. During this time, social workers are able to help patients and families understand mental health services and how to navigate the larger mental health system in the community. We work with a diverse population with unique strengths and needs. Some of the people we work with are experiencing very stressful situations that can impact their mental health and well-being. Some people may not have safe or stable housing, or they may require a more supportive living environment. Others may be experiencing significant financial difficulties or disability and employment issues. Sometimes we work with individuals who are dealing with addiction issues. Social workers can often support patients with these concerns by providing information or making referrals to agencies that can assist further and contribute to the continuum of care. A large part of the social worker's role is to advocate for patients and their families so that they can access as many supports as possible. While we do this, we work in collaboration with patients to support them, encouraging individuals to build on their own strengths so that they are able to advocate for themselves. Social workers also respond to concerns related to abuse and neglect within families. We can guide patients and their families through certain legal processes and future planning, such as advanced care planning. A day in the life of a social worker in mental health is very rich and diverse. For example, we meet with patients individually to discuss their unique needs and goals. We facilitate meetings with patients that often involve family members, doctors, nurses, and other care providers in the hospital and community. We run family support groups, offer education, and help patients to plan their transitions from hospital to home. In our eating disorders program, social workers have specialized training in family and group therapy. They provide the highest level of care for patients and families throughout the entire province, both on the inpatient unit and day treatment program. The Inner City Youth Mental Health Team provides mental health services for youth and young adults ages 16 to 24 experiencing mental health and addiction issues. Social workers strive to meet youths where they're at and connect with patients on an outreach basis across various locations in downtown Vancouver. We work closely with community partners to promote positive health outcomes for this marginalized population.
My role is very broad. But generally I'm working with people to make sure that they have the connections and supports in the community, and also just looking at some of the real basics like housing, finances, medication, ID, and sometimes it's reconnecting people with services that they've become disconnected from, and families as well.
Well, the thing I like the most about my job definitely is the people that I work with. So that can be patients and families. It can also be the members of my interdisciplinary team and all of the professionals outside of the hospital and outside of the organization in the community.
I am really privileged to work with a really wonderful clientele of they're complex clients, and they're wonderfully genuine and wonderfully interesting with really interesting histories and stories and connections in the community, and I think it really is, I'm lucky to be able to engage those parts of their life to work on their overall health outside of just a medical paradigm.